Hi, my name is Dennis Taboda. I'm the president of DTI Training, and I wanted to make this video to give you the highlights of the patient quality management system that was compiled by me, but not invented by me. These are philosophies that were handed down for almost 75 years in the quality assurance industry, and all I did was take these and simply apply them to VA hospitals and medical centers in order to provide patients with the highest quality care that could be possible. Now, these philosophies are proven. We've used them in industry. I used them at NASA, Kennedy Space Center, after the Columbia accident for changing their management practices. I've also used them in the government of Canada, in their aviation world, to enhance their management systems also. So you could read this this patient quality management system yourself, but I'm going to give you the highlights of what it is. A few years ago, I had the opportunity to win a contract with the VA. They wanted me to teach quality assurance in the form of utilization review to doctors and nurses. When we went, our team went to the hospitals, we discovered a management system failure. The hospitals had their processes totally out of control. Unfortunately, we were tied to just teaching utilization review, but we took a lot of information with us on how the hospitals function. So let me explain to you where we are and how the patient quality management system will fit in and work in your hospitals. Right now, we notice that a lot of the hospitals are in built on a management system that really supports the bureaucracy. What do I mean by that? Well, our patients are the reason why the hospital's in business, but the patients seem to drive the hospital's management system through the front line to middle management, which then supports upper management. Now, this is typical of a bureaucracy, and all bureaucracies kind of work this way. In order for patients, our VA veterans, and even the hospital workers, in order for them to have the best quality system, we have to reverse that. Now, what do I mean by that? Well, in the patient quality management system, the patient is on top. The patient then drives the frontline system. That is the first care that patients get, and the first care will then drive middle management, and then what that does is then driven to the upper management support. Now, the difference here is this. Upper management is there to support middle management, which is there to support the frontline worker, which has the highest responsibility of interfacing with the patient. So this is how the management system would work. Now, let me explain to you a little bit more specific on how this will be implemented. The patient quality management system is based on the philosophies of Dr. Deming's quality management system way back in the 50s. And so Dr. Deming identifies some things that are very important for us to understand. In a patient quality management system, the patient drives the system. Let me explain to you how. By using the 5 inputs that were discovered by Dr. Deming and are outlined in his book, Out of the Crisis, Dr. Deming demonstrates to us that these 5 factors affect every process. And these 5 factors affect the system in the hospital. So, for example, they're material, machines, people, environment, and methods. Now, the materials are the things that we would use to treat the patient. Well, the materials then are looked at and analyzed to make sure that they meet the requirements of fulfilling the patient. We'll do this through the quality management system of the existing company, and I'm going to explain that in a few minutes. Then we have machines, of course. Do we have the proper machines to be able to provide quality care for the patient? Do we have the proper environment? Now, this would be the actual building, the waiting room, the things that the patients see when they come into the hospital. These are things that we will analyze also to make sure that we are meeting the requirements of the patient. And then methods are procedures. Now, procedures are going to be very important. We're going to set up a system of procedures throughout the hospital, and this system will drive the processes. Everyone will be following standard operating procedures. We'll be reviewing those procedures on a continuous basis, and I'm going to show you how that will be accomplished. And then we have people. This is important. Why? Because the workers that interface with the patients, the doctors, the nurses, the physician assistants, and so forth, they also need to have the inputs analyzed. In other words, do they have a good environment to work in? Do they have the proper machines, the material, the methods, the procedures, and things like that? So you see how the system multiplies by using these 5 inputs to analyze our entire management system. But the entire system is built on the patient requirements, not upper management. All right, so the patient drives the system, and they are, of course, the most important thing in the system. So now let me show you how the quality management system will actually operate. What we'll do is, the first thing we do is set up a system of policy. What policy? What are we going to do to serve these patients? That policy will be driven into procedures. How are we going to follow through on our policy? Those procedures then will be analyzed by the existing quality assurance department, which under this program will expand and be enhanced. And I'll explain to you that in a second. We're also going to introduce a system of quality assurance audits that makes sure that the procedures are being followed. But in addition to that, every hospital will set up a reporting system. What is this reporting system? It's a system where employees, vendors, patients, anyone in the hospital can report proactive events or things, or reactive events that happen in the hospital. They see something that might affect the patient. So what they do is, we have a system that is non-punitive. And this is so important. The system has to be non-punitive. What that means is, people should not be afraid to report. And this system then will drive reports into this one big Pqms, and I'm going to explain that in a second. So these reports will be coming in, and we're going to teach people how to initiate reports. It's going to be very easy to do, but these reports come into this system. Every report that comes into the system now, the quality assurance system of the hospital, or the PQ, patient quality management system, will review each report for risk. Is it a dangerous thing that was being reported? Is it something that needs immediate attention? Or is it something that we can put on the back burner? Each report will be assigned a risk level. And so every report will go into the system. Also, all of the QA results from the weekly and monthly audits of all the departments will go into the same system. So we'll have one patient quality management system that will consist of quality assurance and operational reports that are given to us. These reports then, the ones that come out either medium or high through the risk review, will then be analyzed to their root cause. We'll use standard root cause analysis systems. These systems were developed by Ishikawa in Japan. Dr. Joseph Duran will introduce statistical process control methods to control patient times and also costs of the system. And these will be looked at on an ongoing basis. But as these reports come in, we will use root cause analysis tools to analyze the system to their root causes and find out what in the system is causing that particular problem. Then what happens is, the department that is responsible for that area must come up with a corrective action plan. It's important that the heads of these hospitals back up these programs, because these corrective action plans are very important and must be implemented. The corrective action plan will then be written by the department. It will be given to quality assurance to go ahead and verify that everything that the department says they're going to do is being done. And then the quality assurance department will schedule follow-up activity to see if the corrective actions of each department have been effective. Now, understand that this is an ongoing process from reports and QA audits. Through this process, as we eliminate and correct root causes of problems that have occurred in the hospital, we will have continuous improvement of that hospital. Also, the reports that are issued, no matter who issues the reports, there must be a feedback process to the reporter to show them that we're serious about their report and it's being actioned, and they need to know what's happening with that report. Meanwhile, through this analysis system, we'll be improving the environment. We'll be looking at the machines that we use, the whatever it is, MRIs, whatever, to make sure that we are totally equipped to meet the patient needs. The procedures, the materials that we use, the medicines and whatnot are all controlled under this system. So you see how the patient drives the system to make sure that everything is under control. And that's so important. And the use of statistical process control in some of these areas will give us now improvement based on variation rather than failure. Now, the way the VA is set up right now is we have the VA that is the head of and controls a lot of the VISNs around the country. Sol and I had the opportunity to teach doctors in VISN 4. So we visited 12 hospitals in that area. So we have hospitals and then medical centers. Each hospital will have its own Pqms system. It's a totally hospital-based system. Now, what we'll do is we go into a hospital. First thing that we do is we set up procedures based on policy and procedures. Okay, policies first, then we set up procedures. Through all of this, though, we're going to be doing training, and that's what my company does. We are experts in training, but of course, we also implement and oversee these programs as they're being implemented. So we set up procedures. After the procedures are set up, then we set up our system of the QA audits, where we're now going to make sure that people are following procedures. Of course, training is still in there. And then once we have our QA audit system in place, then we are going to begin to implement the reporting system for the hospital. Okay? And throughout all of these, there is going to be massive communication through meetings. All right, so communication is going to be really big in this. Remember, it's patient-driven. So what we're going to do is we're going to look at the patients that are involved, that are serviced in that particular area. Make sure that we have people assigned. Remember, front line is the second tier behind the patient, not upper management. So we got to make sure that we're able to fund the first line people, the nurses, the doctors, the administrators that contact the patients. And then we set up our reporting system. And then finally, we have our continuous improvements that is going to occur. Now, all of this is going to produce data. Now, this data that's produced by the medical centers and the hospitals, this data is going to go back to the VISN in the form of what we call key performance indicators, or KPIs. So the VISN then doesn't have to have robust control of the hospital. All they have to do is see if the hospital's own self-healing patient quality management system is effective. They don't have to be involved in it. They let the hospital run, but now they get key KPIs and they can tell the health of the hospital, how the system is working in that particular hospital. And the same thing then could be reported back to VA headquarters. Now, all I'm asking in this proposal is that this system, it's not a new system. It's just being adapted to hospital management practices. This is a patient quality management system that is designed for hospitals and medical centers. One hospital is what I'm looking for. Just, if we could test this out in one hospital, allow DTI to come in, have full control of the implementation of the system. This again works with the existing quality assurance system that's in the hospital, but will enhance it tremendously. Institute the reporting system, and then begin the system of the RCAs, root cause analysis, corrective actions that will be done every week. And initially we might be doing some of them even more than that, because when we discovered that we implement safety management systems, a lot of reports come in initially. And so we start handling those, and as the system progresses and evolves, the reports begin to dwindle out as we correct things. We will see a tremendous improvement in patient care. We'll see a tremendous amount of data that can be used to help us improve our patient system. What we saw before was just a system that was out of control, just supporting a bureaucracy. This system here will be lean, it will be efficient, and will be patient-centered. And please don't hesitate to contact me at DTI so I can explain this further. Or you can get a copy of this report to help you explain, help explain the patient quality management system and how effective it would be in our particular hospitals. You know, the handling of the VA patients, the way they're being handled now, is so heartbreaking. And I know it doesn't have to be like that. We just need to draw from expertise in management systems from the past and simply apply it to these hospitals. So feel free to contact me at dtiatlanta.com, or you can contact us, just look us up on the internet, and please let me have an opportunity to show how exemplary even a VA hospital could be to private hospitals and medical centers by simply instituting this patient quality management system. Thank you for your time, and God bless you.